Hi, my name's Haley. I'm going to be doing the skills video, female catheterization. I'm going to gather my supplies, walk into my patient's room, introduce myself to the patient. I'm going to close the door behind me, introduce myself to the patient. Hi, Mrs. Smith. My name's Haley. I'm going to be taking care of you today. Can I have your name and date of birth? Verify the patient's name and date of birth. Perfect. I'm just going to get all set up here, okay? Hand hygiene. Your doctor's placed an order for a Foley catheter to help you urinate, okay? So I'm just going to gather my supplies. I have my biohazard bin. So set this right next to you, Mrs. Smith. Try not to knock it off the floor, okay? I have a dry cloth and then a cloth with no white or no clean soap. All right, Mrs. Smith, what I'm going to do is I'm going to have you I'm going to lay you back flat and then bring you up. So I'm going to lay you back, bring you up. I'm going to have you bring your knees up and then I'm going to have you drop them out, okay? Kind of like a butterfly. All right, and then I'm going to raise your drape. I'm just going to inspect your perineal area. I'm just looking for any discoloration, discharge, redness, anything like that. Everything looks good. I'm going to take my cloth with soap on it, and I'm going to clean anterior to posterior, farthest side away from me, closest side to me, down the middle. Mrs. Smith, you're going to feel me touch you. And then you're going to get a different side each time. Also making sure everything is on a flat, clean surface. I'm just going to pat dry, feel my touch. Perfect. Alright, I'm just going to get my catheter set up, okay? I'm going to place this in between you, so try not to move it so it doesn't break sterile field. For learning purposes, this has been open, so it's not staying together very well, but it would be a brand new one that would be all wrapped up together. Grabbing at the 1-inch margins on the outside. Pick up my sterile gloves for the demonstrations video because I don't have much space. I'm going to move this to the side just so I can show you my sterile gloves, but I would not do that in the actual insertion. Grab in the center to maintain the sterile field and dispose of my trash that I have over here. And then I am going to grab on the 1-inch margins just to make sure I'm keeping that sterile field, but I wouldn't have to move that normally. All right, Mrs. Smith, I'm going to get you all draped up, okay? Can you lift your hips for me? Perfect. Gonna get set up over here. I have alcohol swabs. Disposing of my trash, lube, my saline solution. I'm going to attach to my tubing. And I'm going to place my Foley catheter in the lube. Disposing this in my trash. All right, Mrs. Smith, I'm going to clean your perineal area, okay? That remained in the sterile field still. Okay. Same thing. I'm going to grab or clean outside, inside, down the middle. You feel my touch? I've also visualized the Venus. I got my Foley catheter about 2 to 3 inches below. All right, Mrs. Smith, when I do this, I want you to take a deep breath in and exhale. And exhale is when I'm going to insert the catheter. If you feel any pain at any point, please let me know, okay? Are you comfortable still? Awesome. Feel my touch. Deep breath in and exhale. Perfect. I have urine flashback, so I'm going to proceed about 2 more inches in. Perfect. Going to inflate the balloon with 10 cc's of saline water. And then I'm going to pull back to meet resistance. And when inflating the balloon, hold the catheter. All right, now you don't need to be sterile. I'm going to take my urine bag and give the patient some instructions. All right, Mrs. Smith, I'm going to attach this portion to your upper thigh. At any point, if you do not have slack in this line, please give us a call. We don't want you to rip it out. This urine bag is going to be attached to the bed frame and no moving parts, so it doesn't also rip out. If you move in bed and you feel any tension, please give us a call. If you would need to get out of bed for any reason, please give us a call. Okay? I'm just going to get you all cleaned up here. Perform hand hygiene, grab off my garbage, and then leave the patient's room and go document.